I look at this number and I see overall about 1 in 10 people report that they're delaying medical care around coronavirus symptoms due to cost. Now that's a very specific reason why that they're delaying care. There's actually data out there that asks this question more broadly. At the end of last year, Gallup asked how many people were delaying healthcare due to cost generally. And it found, that poll found that more Americans are delaying medical treatment than ever before. About a quarter are delaying treatment for a serious condition due to cost, and it's overall 1 in 3 report that they're delaying medical care due to cost. So in the grand scheme of things, the folks reporting that they're delaying care about COVID-specific symptoms looks pretty low. You know, we know that more people are foregoing medical treatment and are concerned about the cost of care generally. So whether that's because they just, less people are just personally impacted by the virus right now, we don't know. But I think when you look at the bigger picture, what we do know is the following. Healthcare is getting more expensive year after year after year. And as of the end of last year, seeing that 1 in 3 are delaying medical treatment because of cost, I think shows where people are at when it comes to our healthcare system. 1 in 10 report, about 1 in 10, slightly more, report that they're not seeking treatment for COVID-related symptoms due to cost. But actually, if you look at the data underneath, there's an interesting breakdown by age group, where younger folks are much more likely to report that they're not seeking treatment. And I think that's for a couple reasons. The first is, as we know, healthcare in this country is getting more expensive. Costs are going up and up and up. And when you look at the younger generations, millennials who were coming of age during the Great Recession, trying to find work out of college or trying to move up from entry-level positions in the time of a recession, Gen Z who are coming of age and trying to find jobs now. The fact is that younger people just don't have that safety net that was provided to older generations. So to me, it's not surprising that more are saying that they're foregoing medical treatment because of cost.
I think when we're looking at polling about how people's approach to care is changing as a result of COVID, we have to take into account maybe what were trends that were already taking place. So we know that younger folks are more likely to defer care and are very cost sensitive. And then finally, older folks are pretty conscientious about their care and making sure they're getting to their appointments, figuring out how they can pay for it. And of course, they're often on Medicare. So I think the question now is how much of the trends do we see are being either intensified or alleviated by coronavirus? And I think that what we're seeing, at least early signs, is that most of the people that are losing their jobs are younger. And of course, a lot of older folks are too, but I think the proportion is much higher when you're younger. So just the sheer economic stress on younger folks is really, really increasing. And so I wouldn't be surprised to see if these early trends that you see in the polls are starting to intensify. And I think it tracks with the political aspirations of this group about wanting to have some sort of solution for healthcare costs.